A very good morning, doctor. Very good morning, doctors, all of you. I think I am loud and clear. I'm loud and clear. Yes. So don't think like I will given a long break for pharmacology. I will continue. Don't think otherwise, right? So actually, we will start something called short bursts. The name of this series is called short bursts, right? So short bursts. Psychiatry is a minor subject, so it's just like a short burst. Within short bursts only we'll finish the complete psychiatry. Okay, this is just a short burst. That means we'll just take an MCQ, which is the most probable MCQ. Previously we got at least for once or twice, so we'll just analyze it and we'll just discuss the topic without making any delay. We'll get into the topic right now. Okay, so what's the question? So calluses and pigmentation, you just listen carefully. Calluses and pigmentation on the dorsum of hand, on the dorsum of hand. So these two, I think already you got the answer. Calluses and pigmentation on the dorsum of the hand due to purging. Just 4 words, we get the answer. Due to purging is seen in, right? Due to purging is seen in. What is the answer? Can anyone? Yes, it is purging. In which condition we will do purging? Can anyone? In which condition you will do purging? Yes, it is done in bulimia nervosa. It is done in bulimia nervosa. So B is the answer. Okay, but my question is, it's okay, but in Inicet you won't get such a sort of question. What is the sign called calluses and pigmentation on the dorsum of hand due to purging? The sign is called, very simple, yes, Russell's sign. Very important psychiatric question. You might get an MCQ. This is called a Russell sign. The sign is called Russell sign, which is seen in bulimia nervosa. Chalo, let's discuss something about all the binge, all the disorders, all the food disorders. We'll just listen, we'll just check on. Okay, the first one is anorexia nervosa. The second one is bulimia nervosa. Guys, this is short and sweet. You just listen, everything will be all right. And fourth one is binge eating disorder. Third one is binge eating disorder. Okay, anorexia nervosa, bulimia nervosa, and binge eating disorder. So the first one is, in which age group anorexia nervosa is seen? Early adolescence. Early adolescence. Okay, now bulimia nervosa is seen in late adolescence. Late adolescence. Binge eating disorder is seen in young adults. Young adults. I just want to discuss a small terms. Can anyone? What is neonate? Less than 30 days. What is early neonate? Less than 7 days. What is late neonate? 7 to 30 days or 7 to 1 month. What is infant? Less than 1 year. Okay, these things are very much important, so just remember. Okay, I just somehow got this into the mind, so I just discussed with you. So presentation, how the presentation will be, presentation is, in case of anorexia nervosa, they are always having fear. Fear of what? Fear of weight gain. Fear of weight gain. Then always they have something called distorted body image. Very important. Distorted body image. Right? Remember this. Next, they have nearly less than 50% of ideal body weight. They have a body weight of 50% of ideal body weight. These all are important points. Just listen. No need to write. Just listen. Now, anorexia nervosa are actually 2 types. Remember, they are actually 2 types. First one is restrictive. And second one is binge purge. Very important. Most of the people will get confused between here and binge eating disorder. Don't get confused. Anorexia nervosa It's fear of it. The patient has a fear of weight gain, means she has a fear of maybe I'm gaining weight, I should decrease the weight. So obviously most of the time she will be having a distorted body image. Remember, she will be having a distorted body image, and her body weight will be 15% of the ideal body weight, even less than that, less than 15% of the ideal body weight. And anorexia nervosa is of two types. First one is restrictive, second one is binge purge. Okay. Now what is the BMI in case of anorexia nervosa? We already discussed, because she has only less than 15% of the ideal body weight. So obviously she will have a low BMI, that is low, less than 18%. Right? And in some books they give like 18.5, but anything is okay, no problem. 18 or 18.5, see, anything is okay, no problem. 18 or 18.5%. Now coming to the bulimia nervosa, I think we should draw a line here so that it will become clear, and we will take one more line here so that it can divide. Okay. Now what about bulimia nervosa? Bulimia nervosa is something which we see in late adolescence, and always the patient or the girl have binge eating, always eating, and she will always do purging. She will always purge, binge eating and purging. Okay. And what is the main difference between anorexia and bulimia? Anorexia nervosa have fear of weight gain, but bulimia nervosa patients, they don't have fear of weight gain. No fear of weight gain. This is very important. Just give it an underline. Now coming to the binge eating disorder. Binge eating disorder are mostly seen in young adults. Obviously. We always eat, right? We always sit and eat with our friends, right? And the most common thing is, it is the most common eating disorders that you mostly see in young adults. Most common eating disorder. Why? Because they always feel stressed, they eat food. They always feel sad, they eat food. They always feel happy, they eat food. So whatever emotion, whatever expression, whatever feeling that might emerge in their heart or soul or mind, they simply eat food. Go to KFC, have a bucket. Now what is binge eating? This is very important. This will be sparking in the Inicet. Okay. Binge eat is something which you consume food beyond the fullness, something which gets gulping, which gets out of the throat, like it's beyond fullness, right? So they have some features like isolation. They just simply isolate themselves and always they eat. Not hungry, right? And they sometimes have guilty of doing all these things. Sometimes the patient feels guilty of doing all these things, and the pattern of eating also, they eat rapidly. Now I think we missed something here. What is the BMI in case of bulimia nervosa? It is normal. Remember, bulimia nervosa patients have normal BMI, whereas in case of binge eating disorder, what is their BMI? Their BMI is high. Why? Because they eat beyond the fullness. They are obviously, you are eating continuously, so will you feel hungry? No. Sometimes they feel guilty because they are doing such a sort of thing, like always eating, but still they eat, and also they eat very rapidly. Their BMI is high. Okay, so those are some differences between anorexia nervosa, bulimia nervosa and binge eating disorder. But if you ask me, sir, what are the complications of anorexia nervosa, which is a prominent question that most oftenly arises in Neet PG more than Inicet. Now the first complication is medical comorbidities. medical comorbidities. It's something like related to CVS or endocrinological. Why? Can someone tell me? Simple. It's very simple. Women, girls, what happened? More weight, more androgens, more hormones, more stimulation, more follicles, but arrested growth due to imbalance in the hormone, leading to formation of what? Polycystic ovarian syndrome. Polycystic ovarian syndrome. Finally, the women candidate land up with polycystic ovarian syndrome. If it is irreversible, it becomes a disease or disorder, right? If it is irreversible, it cannot be reversed further. So that is what it leads to, some serious comorbidity. So endocrinologically, these are the complications. So what are the serious complications? Obviously, more cholesterol, more fats, the so-called more pressure gets been exerted on the heart itself. So obviously, the serious abnormalities or serious problems you will be getting, comorbidities, right? So the next one is Lanago hair. It's something very important. You ever seen a young girl having hair on her face? It resembles like secondary sexual characters, but sometimes we define these type of things as Lanago hair. Okay, Lanago hair. Next, they have increased prolactin levels. That's defined as prolactinemia. Hyperprolactinemia causes hyperprolactinemia. Guys, every statement is an MCQ. Hyperprolactinemia. Most of the students don't go these type of things while preparation. Ultimately, they come up as MCQs in INICT, and finally they get failed. So don't do these mistakes. So hyperprolactinemia is seen in anorexia nervosa. Hyperprolactinemia leads to what? Increased prolactin levels cause what? Amenorrhea. What happens in pregnancy? In pregnancy, do you have cycles? Do you have menstrual cycles? No. Why? In pregnancy, what happened? Mother has feeding, lactation. Mother has a feature of lactation. Lactation means which hormone is acting? Prolactin. Prolactin is there. There will be no cycles. That is, in pregnancy, mother will be in amenorrheic state. So no cycles will occur. Same like in anorexia nervosa, the patient will have hyperprolactinemia, increased prolactin levels leading to amenorrhea. Now, there will be a 10% risk of suicide. There is a chance of 10% risk of suicide. Patients may commit suicide, yes, despite of regret. They might commit suicide. 10% of chances are there. Next, they have something called refeeding syndrome. Refeeding syndrome. Guys, no doctor will write like that. Everyone just bring the PPTs pinpoint already pre-prepared. But I am writing this because so that you will get interest and you will also follow with me. Refeeding syndrome. What happens? Refeeding syndrome. There is an increased calorie intake during treatment. There is increased calorie intake during treatment, leading to what happened during treatment? If you take excess calories during the treatment, what will happen? Simple. What happens to the potassium? What happens to the phosphates? What happens to the magnesium? Right? What happens to the magnesium? All these things will be decreased. Now, if you see refeeding syndrome in anorexia nervosa. Okay. Now, going to the next page. So, that is all up to anorexia nervosa. Then, what about complications that are caused by bulimia nervosa? Bulimia nervosa. Okay, these are important things. As I always said, bulimia nervosa patients, they might land up with a condition called, can anyone guess what is this condition? Mallory Weiss syndrome. We will discuss this one in the surgery in detail. Until then, you just read here Mallory Weiss syndrome. What does it mean by Mallory Weiss syndrome? What happens in Mallory Weiss syndrome? There will be a lower esophageal tear. There will be a lower esophageal tear. But remember, there is one more type of syndrome that has the similar type of features. That is, there will be a esophageal tear, but we will discuss that one in the surgery itself, right? So Mallory Weiss syndrome is seen in bulimia nervosa. Then one more thing is retching is observed in these patients. Retching. Next, previously we will discuss Russell's sign. Russell's sign is seen. What is Russell's sign? Russell's sign is calluses and pigmentations that are observed on the dorsum of hand. Dorsum of hand due to purging. Okay. So that is all about complications of anorexia nervosa and bulimia nervosa. Okay. Russell sign we read now. What is that? Calluses and pigmentation present on dorsum of hand, which are caused due to purging. That's it. Nothing much. Finished. That's all, man. That's all you can have. Okay. So we'll come with next topic again.